Welcome back to Good Day Stateline. Dr. Kapur is with us virtually tonight from Transitions Hospice. Hello.
Hi there. How are you today?
I'm good. How are you?
Doing good. Doing good.
Okay, so Happy New Year. I know it's like a little late in January, but we haven't seen you this year yet.
Happy New Year.
Happy New Year. We want to talk, of course, about Transitions Hospice and how adjunct therapy is a big part of transitions. Tell us a little bit about it.
Yes. So we are quite integrative at Transitions within both of our, all of our programs, actually, in our primary palliative programs, as well as our hospice programs. And we have a variety of ways that we can support the patient integratedly.
So I got this lovely list of these different therapies that are part of what Transitions does. And the first one on the list is pet therapy. And I didn't know you guys did that. So tell me a little bit about it.
Yes. So pet therapy is utilized in select location in conjunction with agencies such as Canine Comfort Dog Ministries to provide soothing touch to the patients. As you know, many patients can, medically benefit from this too. Pet therapy has been shown to improve patient satisfaction, energy levels, self-esteem, and mood, as well as decrease depression. Additionally, it can increase motor skills and movement, improve social skills, verbal communication, decrease boredom, and have more of a positive outlook.
Which is pretty awesome, especially obviously when you're dealing with something not so positive to begin with.
Exactly.
So also massage therapy and music therapy are part of your adjunct therapy. So how do you incorporate that into your hospice patients?
Right. So massage therapy is ordered often, actually, in our population because it's quite soothing and healing in end-of-life care overall. Studies have shown that integrating massage therapy into palliative care found statistically significant changes in pain, anxiety, relaxation, and inner peace, decreasing both pain intensity and anxiety while increasing the sense of relaxation and inner peace.
And then music therapy, how's that incorporated?
Music therapy is very interesting to me. It's all of us, when you hear a song, right, you remember a certain time in your life. It can be very similar because music is triggered in the amygdala, which is the emotional part of our brain. Music can elicit emotions and memories to help provide a link to a person's past, promote connection with caregivers, and also it's especially important in those patients with dementia. We'll find that patients will start singing a song that, and they haven't really been verbal in a long time in dementia because of that trigger. Neurology studies show that music training delays cognitive decline, promotes brain plasticity in elderly, we need more studies to confirm the benefits of music therapy, but we do offer this in many of our locations as well.
I was reading, I think it was in December, Lady Gaga and Tony Bennett were performing, and she came out and she said that like prior to the performance, he didn't actually recognize her, and then they started singing together, and it was like, boom, the music just took him away.
Right, it is connected to memory, and it's amazing. And so it can be extremely beneficial. We take care of a large portion of dementia patients.
Mm-hmm. Okay, you also want to mention the volunteer program that you guys have.
Yes.
So how can our viewers be a part of that?
Right. So our music, our volunteer program is very important. And we are always looking for people who have skills in legal, cosmetology, Reiki, any additional skills that we can provide to our end-of-life patients. Also, they assist in making memoirs, life enrichment with our patients, spending time with them, maybe translating. My mother-in-law is a volunteer in the North Chicago area, and she's translated and kind of explained in Hindi, some different patients' conversations. They can provide, memoirs such as jewelry and memory teddy bears. So we are always looking for volunteers, and we provide this as an adjunct to sit with patients and support them through their journey.
I love that so much. I think everything we just talked about today really emphasizes the difference that you can find with palliative care and with Transitions Hospice that other options really won't have.
Thank you so much for having us, and we really appreciate working with you as well.
Awesome. Well, I think we'll be seeing each other in a few weeks, so thank you for joining us tonight.
Thank you.
We'll be right back with Lil Zim and JB Love from Q98.5 for Spirit Day.